I'm the director of the Biomedical Research Techniques course, who also has a cold. The course itself this year, again as Leslie mentioned, has been compressed very much into an extended Monday morning. So, which we're sort of trialling this year, so we rely on you for any valuable feedback on how well you think it's working. The course itself has been set up for PhD students as well as MD and MPhil students, and it's really to provide you with those skills necessary to help you get your research degree. And it's in 3 parts. So there's a core part of the course, which begins next Monday, as well as a laboratory techniques part of the course for those students who are doing lab-based research, and that begins next Monday as well. There's also a qualitative and quantitative research methods course for those of you who are doing data handling type projects or patient related research, epidemiology type studies that will begin after the core course in the spring semester. I think it's the second week of January actually, rather than the first week of January. For all those people who are thinking of doing that, you need to talk to your supervisors, or everyone here who's doing a PhD has to do these courses. For those of you who are doing patient-related research, you need to talk to your supervisor carefully in case what we're going to give you is already covered in what they're providing. I know that some of the people, especially in clinical epidemiology, do provide extra training, and so we need to discuss that and make sure you're getting the right training. You have to attend these courses, or you have to apply formally for an exemption from them. And this year we have a form, which I think you've already been given, that you have to fill out if you're not going to, or think you will be able to, convince us that you shouldn't come to the courses. MD students and MPhil students don't have to come to these courses. Some of you may find that the information in them is useful to you though. But if you're doing an MD or an MPhil, please fill out the exemption form anyway, so that we know that you've actually seen the information and thought about it. And that we can then make sure that you're actually getting training as you go, as you answer the questions on the form. I've highlighted here a few places where you'll be taught on the different courses. There will be an introduction to the programme next Monday when you turn up. I think it's actually in here. But there are some places where you'll be taught that you may not yet have visited. So there's T. Devisant, which is on the far side of the campus, away from here towards the Heath Park, and the Cochrane building, which is the new building that still has what looks like cling film wrapped around it in parts, which is even further over on that side by the park. There's, just to orientate you, that's where the lake and the fountain are, and we're over here at the moment, so you can see that we do spread you around to receive some of the teaching on these, and some of them are held over in the dental school as well. The Duthie computing laboratory that I've highlighted here may or may not be used depending on whether the Cochrane building is fully opened or not. This is something that, I'll mention next Monday, but I may have a better idea on how well developed the Cochrane plans are by then, because the library rooms are all going to be moved over to the new building at some point. All the course details, or as many as we can, when I get them from the lecturers, will be put onto Blackboard, onto Learning Central. But I'll also email all the lecture details ahead of time to you. No, that's the intention. They should all arrive by email ahead of time, and that will probably be my preferred way of getting in touch with you as well. We'll try and use Blackboard, but we have found in the past that a lot of students don't look at it every day, whereas most people will answer emails within 30 minutes. And so to make sure we've got everything up to date, we'll use email. We will have summaries and objectives for the lectures, and we'll put other details there on Blackboard if we need to. So this is just to give you an idea of what the Learning Central pages look like on the website. I'm not an expert on Blackboard, but there are training courses, and Sarah Williams in the PGR office has been trained in Blackboard, so if you have any queries, she'll answer them. And that's our course. That's what it's called, actually, on Blackboard. It doesn't have any of the university codes next to it. It's just postgraduate research studies. And there's an announcements page that we will use if there are very important announcements that you need to know about. There it is highlighted again, and it's kept in separate parts like that. So you have the core course, the lab course, and later on in the year there'll be the Q&Q research methods course as well. I'm not going to go into, we'll leave that there now. As I say, you can contact Sarah about using that. I'm not going to go into the course details now with how it's assessed, but I do want to point out one thing, apart from the fact that I've got the date of the induction wrong on this slide. The core course, the statistics sessions that every PhD student has to attend or be exempted from, begins next Monday, 10:15. Please be very careful with your timing to get there. There are things that are happening before that in Lecture Theatre 4, and there are things that are happening after that for other parts of the course. As you can see, it's very heavily weighted towards statistics when you start off on this. Ooh, that doesn't look good. But we do go on to look at more research skills directed learning later on, how to keep records and present, and some of the ethics of research as well. The reason I said about timekeeping, although this hasn't come out very clearly on this, on the very first, on the Monday next week, sorry, here, there's we'll be doing an introduction for the laboratory-based course, which starts immediately afterwards, before the core course actually gets started. So when the rest of you turn up, who think you'll be doing qualitative and quantitative research methodologies, there'll already be people in the lecture theatre. So turn up quietly and sit down before the statistics session begins. It looks complicated, and I hope it won't turn out to be too complicated. But I'm pointing it out because you will need to keep very strictly to the timetables that are down, that you've been given. There are gaps between lectures to allow for movement, and there are lunchtime breaks as well to allow you to get to places and from places. But the timekeeping will be very important. We haven't arranged the qualitative and quantitative course yet. I've got a problem with at least 2 of the teachers who can't make the normal times we do it. But during the next couple of weeks, I expect to sort that out. So those of you who are going to be doing patient or data handling type projects, I will be getting to you over the next couple of weeks and giving you some ideas of when things will be happening. As I said, you must do the training course, so talk to your supervisors and mentors. If you're not sure whether you're going to be doing purely lab-based or purely population-based type research, find out, talk to your supervisors, and if you think you need to be exempted from the course, fill out the form properly and submit it, and we'll get back to you as soon as we can.